Hello, I'm Ileana Piña and I am your chair of the FIT committee. I want to take a little time to go over with you why was it so important for me as a fellow to come into the American Heart very early. I was lucky enough to have a chief and a fellowship director who had already been actively engaged in the American Heart. And I could learn more about it, and that's way back before we became as well developed and as digitized as we are today. This is a place for science. This is a place that cares about the patients that we all take care of. We are the scientific bone of cardiology, and many of our committees, particularly in the Clinical Cardiology Council, are the people who put out those statements and those guidelines that you and all our colleagues are using today to apply to care for the patients. So for me, it was important that I could help shape medical care. I could help shape cardiology care with my contributions. Do you have to work at it? Absolutely. This is not easy work. This is hard work. But if your heart, pardon the pun, is really in it, you will do it and you will do it gladly. And when you see those publications that carry your name in them and people are quoting them and saying, but the American Heart says this and that, you become a leader. And leadership begins with not being asked to do something, but actually volunteering to do so. And that's what got me interested. And then I got to move into the national committees. And in the national committees, you really make changes, terrific changes, and new opportunities. For example, I have been with Get With the Guidelines, which is in so many hospitals in the country to improve care. So that's the other part of what we do, is trying to improve care at a grassroots level. That's exactly what Get With the Guidelines is. We have Mission Lifeline, where we're out there in the community trying to improve the care of patients who code and arrest in the community. You see them in the emergency room. I see them in our coronary care units. We're reaching out before they arrive at the hospital. So we are multidisciplinary, we are multifaceted, and you will have the opportunity to really get in here and become a leader, and I welcome you.